Author Family System, 2060, Natalia Poluektova, Pisareva. Method The Voice of Sleep, a Mama B case document. Modular. Speech Restoration System, Post-vaccination encephalitis following DTaP. Part 1. Post-vaccination encephalitis following DTaP is a rare inflammatory disorder of the brain that coincides in time with DTaP vaccination and is considered an immune-mediated reaction rather than a direct infectious complication. Analytical review of the clinical condition. Speech is dependent on the central nervous system. Damage or disorganization of speech-related neural networks in cortical and subcortical structures occurred. And the child lost previously formed speech at the age of 2. This is a functional neural disorder. The goal is speech restoration. The child is 10 years old and the brain retains plasticity provided that the intervention works directly with activation and reorganization of neural networks. Addressing the core of the problem. Central nervous system impairment disrupted speech networks. The absence of targeted intervention led to stable silence. Point-specific intervention is directed at restoring functional interaction between frontal and temporal speech areas and their connections. Anamnesis. The nervous system and brain operate in a parallel processing mode. The girl simultaneously processes sensory input, emotional signals, and the level of the current situation. Analytical review. In adults, it works like this. General understanding emotions, details. First, a person grasps the overall meaning of what is happening. Then, emotions are engaged. After that, attention shifts to details. In the child, this separation is absent. Instead of processing information step by step, everything is perceived at once, like the whole screen being on at the same time. There is no filtering. All input arrives together. As a result, the volume of information overloads the nervous system. Anamnesis. The level of understanding is high for her age. She analyzes situations and people strategically and makes decisions like an adult, due to long-term systematic load on the nervous system. Developed through years of training, she has formed her own rapid way of reading people. When a person increases tension, her nervous system reacts immediately and withdraws. Her internally constructed inner world allows into her space only a calm, controlled, and predictable person. When active speech stopped at around 1.5 to 2 years of age, she developed a way of interacting through movement, touch, smell, vision, imagination, intonation, facial expressions, play, and control of the surrounding environment. This is reflected in her interest in dolls, dressing up, hairbrushing, and organizing space. Increased auditory sensitivity and an expanded range of perception intensify the sensory load. Analytical review. Sensory functions, the foundation of perception, vision, hearing, smell, touch, as well as the vestibular system, movement, and the proprioceptive system, body position,